Essentially, the main focus of this project is to define and establish an electronic healthcare record that will be able to meet the standards of particular healthcare organizations by implementing a way to effectively and efficiently organize patient care. By doing so, this will allow the further reduction of any possible medical errors that may arise, as well as providing and establishing customer service to the said patients being attended for. To grasp the entirety of the scope of the implementation, Microsoft Project was used to outline the overall tasks that will be completed within an 8-month time span. The major tasks are noted as patient information management, laboratory, radiology, nutrition and food services, pharmacy, imaging, and lastly, clinical information systems. Essentially, the tasks noted are specifically numbered from start to finish, as the preceding tasks must be completed before the next can begin, hence the predecessors. So by starting off, the first major task, which happens to be patient information management, is going to be followed up by each individual subtask for that category with the start dates noted. So in this example, some implementations are going to be followed up with training. Training must be implemented no earlier than the day after the related module happens to be completed or configured. What we can assume is that the training sessions cannot overlap, as the individual cannot be attending 2 different training sessions within that organization at the same given time. Also at the fact that the individual will not be interfered with other subtasks that happens to start around the same day period or at the same time, thus preventing the training sessions to overlap. From taking a look at this example, you can see that training A, B, and D have a start to finish date that happens to be spaced out with 1 day apart. You can see that after the first training session has ended on 05/9/17, the next training session will begin the following day after. Thus, you can conclude that the training sessions A must be finished prior to starting training session B and D. So when taking a look at the planning implementation of radiology, you can see there happens to be tasks and subtasks that are starting on the same date as one another. Because of modern advancements of technology, we can essentially assume or start those tasks at the same time, as those primary tasks do not require a separate attendance, as taken from the example of training, where once again, training isn't allowed to overlap, as the individual couldn't possibly be able to attend at 2 places at the same given time, and at the fact that the individual will not be hindered with this training session with their other subtask categories. When taking a look at the overall planning graph, you can see that it's easily noted where you may be able to adjust or make any sort of scheduling corrections without having to refer back to the project dates. This will basically allow for easy updates if there happens to be any changes throughout the course of the 8-month timeline. So for example, when taking a look at pharmacy, you can see that the initial duration was set for 63 days. However, since it was completed early, the second example shows that clinical information systems was moved forward to compensate for the remaining days. Using Microsoft Project happened to be an rewarding experience because of the fact that planning and coordinating particular events can be easily managed and corrected without much effort. When trained properly, Microsoft Project will definitely allow for faster and easy implementation of multiple projects and events while still providing a user-friendly interface. Through the use of this program, it's extremely easy to visualize, manage, and communicate with others within the organization in regards to what particular events will be started and how conflicts will be either ignored or could be avoided.